Good afternoon, gents. This is Ralph Marucci. I'm here to discuss Fusion Pain Cream, and in the next couple of minutes I'll be discussing several different things about the product itself. I'd like to enumerate a few things right now. I'd like to just discuss who is Fusion, the skin's anatomy, the base of our creams, what the foundation is, discuss a little bit about the 5 medications that are incorporated into Fusion and some of their components, some of those drugs that are included, and finally a little bit about our competition, mainly Voltaren, and we'll discuss that as we go. But first and foremost, I'd like to just discuss who is Fusion. They are a group of pharmacists, or pharmacies I should say, specializing in pain management as well as hormone replacement, infertility, and erectile dysfunction. For our purposes, we're mainly focused on the pain management side of things. Their goal, as well as now ours, is to ensure that the patient and the doctor have the most total therapeutic experience when it comes to this, especially compared to others of our competition. So it's a compound cream, and just discussing where there will be addressing would be our actual skin. With our skin, we are faced with 3 different components. First, the top layer, which is the epidermis, followed by the dermis, and the hypodermis, which is the source of usually where the pain is located, and the nerve endings. That's the point that we'd really like to focus and treat, and that's where we differentiate ourselves from our competition due to our DMSO driver, which I'll get into in a moment. But first, again about the skin, the top layer, being the epidermis, is lipophilic, which means that it likes the fat, or fat-loving layer. Means that it would actually absorb fat on the surface. Then you get down to the next level, the aqueous level, or the dermis, and that level is fat-fearing, meaning that it won't absorb fat at that level. Most creams would need 2 active ingredients in order to get by both of those levels. We are, in our compound, we actually are able to do that. The base, or the foundation of Fusion Pain Cream, starts with a little bit of lipoderm base, which serves as a medium to bring the medications in a way where they can be prepared to be brought down to the source of the pain, which, as we discussed, is the hypodermis. The only way to do that would be to include what's known as a DMSO driver. DMSO stands for dimethyl sulfoxide, and if you've ever smelt it, it's a little garlicky. When rubbed on the skin, it is systemic, especially in large doses. We only use about 10%, so for our purposes it's not terribly systemic. Other competitors may use more, like up to 45%. That can be too much of a good thing in a sense. It will actually tend to dry out the skin, okay, and kind of work adversely in the sense where your whole body will be smelling like garlic. Patients don't really like that sort of thing. And then we take another step further. Rather than use a extra garlicky smell, we actually include menthol. Menthol, lets the patient know that the ingredient is working. I know I have conditioner with a degree of menthol in it. You get sort of a tingly feeling on your scalp. That's how you know you're feeling that the ingredient is working. And it actually helps to absorb the medicine slightly, a little bit better, increases that absorption. So those are the 3 major bases of Fusion. We get down to the next step, which would be the actual medications. There are 5. The 5 major medications, one we just discussed. Well, actually, we didn't discuss, not the DMSO. Would actually be non-steroidal anti-inflammatory drugs, such as our main component, diclofenac, also known as NSAID, N-S-A-I-D. Secondly, you have an NMDA and receptor antagonist. NMDA stands for N-methyl daspartate. believe I said that correctly, NMDA. Major one to list would be ketamine, which we'll discuss momentarily. Then you have muscle relaxants, you have antispasmodics, and you have a local anesthetic. So those are the 5 major medications that are used here. There are 13 actual drugs that are mixed into the compounds. As we mentioned, it's customizable. So there are 6 different options that include all 13 drugs variated throughout. It's up to the doctor to choose which ones he'd like to use. For us, the main one that we'd like to go for, or the best moneymaker, which also sees the best results, would be number 6, which includes ketamine. Ketamine, as we discussed, is the number 1 NMDA receptor antagonist that we know of. Works excellently with neuropathic pain. Okay, it's very important for clients that may have some form of radiculopathy, intense pain that can stem from chemo, any type of diabetic sick illnesses or neuropathy, any type of joint disease. Ketamine is strongly recommended. There are studies that show that it is a very key element when used topically, obviously versus orally, and it makes a big difference. NMDAs are typically anesthetics, a group of which, and ketamine being the most popular, is highly recommended to be used. Diclofenac, which is our probably most active ingredient, versus something like Voltaren, which only uses 1%. We use triple that amount, 3% diclofenac. Diclofenac is very interesting because it's actually going to, alleviate pain itself. It's, like I said, it's the key ingredient. It's an NSAID, as we also mentioned. It's the leader NSAID in the formula itself, and I think it's very important that our product includes NSAIDs and includes particularly diclofenac. Going beyond that, we have baclofen and cyclobenzaprine, which are both muscle relaxers and antispasmodics. They do a great job at just relaxing the source of the pain itself. Tetracaine and lidocaine are local anesthetics to actually numb the pain itself. And we have several other key ingredients that make up the drug. Versus, again, our comparison, our competitors, Voltaren being number 1 right now, as far as these creams are concerned. We have distinct advantages over them. We have triple the amount of diclofenac. We take care of all pre-authorizations. Typically, we're less expensive. About 75% of our clients pay about $40, whereas most of theirs are around $120, if not more. And that's certainly a huge advantage when dealing with offices and pitching the staff on it. There are Flector patches that we also compete with. They aren't quite as practical. They're actually patches that go on your back, and what'll happen is, if you have pain here and here, you have to put on two separate patches, and you have to wear them for 12 hours, which, if you're somebody who's working actively, would be quite cumbersome and probably a little bit difficult to deal with, and probably see much less people using what they're supposed to as recommended, instead of getting full compliance, which is the goal. And going beyond that, there's Lidoderm, which is also a patch, uses 5% local anesthetic to numb the pain. Really doesn't get to the source. Really doesn't treat it. Again, none of these other users have a DMSO driver, which is again the key ingredient here. And overall, just to summate, we have more efficacy, less out of pocket, less hassle for the office staff. That's the nuts and bolts of the argument to use our product, Fusion, over anybody else, and certainly versus orals, which will damage the body inside and out, and is highly addictive. So we recommend Fusion, and we hope to have you and yours give it a try if and when they have superficial pain. Thank you.